Welcome to County Chatter. Today, we're talking a subject that might be a little difficult for folks. With me today is Jacob Stapledon from Children's Cove. He is the Community Engagement and Education Program Manager. Jacob, thanks for joining us today. This is probably one of the most important programs coming out of Barnstable County. Children's Cove is just an amazing organization, a safe haven for parents and children. Tell us a little bit about what you do there and what is Children's Cove?
Yeah, absolutely. So first, thank you for having me. It's just a great opportunity to highlight the work that we do. As my title implies, everything that I do is related to our community engagement, education, awareness, to the community about who we are and what we do as a department of Barnstable County, about the issues related to crimes against children, and also providing and coordinating professional training for our multidisciplinary partners. And because what we do is very specialized, it's very unique. We are the only organization on the Cape and Islands doing what we do. And what we do is we work with collaboratively investigative agencies, including the Cape and Islands District Attorney's Office, all departments of law enforcement across the Cape, Nantucket, and Martha's Vineyard, as well as the Child Protection Agency for the state of Massachusetts, which is the Department of Children and Families. We work collaboratively with them for the comprehensive investigation, as well as the best practice coordinated response to cases involving child sexual abuse, severe physical abuse, witness to domestic violence or crime, as well as sexual exploitation of children, which kind of has a few things under it, and that includes online exploitation, cases involving child sexual abuse material, as well as commercial sexual exploitation of children, which is otherwise known as human trafficking.
My goodness, and the agency has been around for how long?
We've been around since 1997, so we're just a little over 25 years. We celebrated our 25th anniversary in the fall of 2022, and we started as a part of a task force put together by the county, by the Cape and Islands District Attorney's Office, by stakeholders in the community and law enforcement, really to look at a way in which we can provide a coordinated response to these types of cases on the Cape and Islands. At that time, the Child Advocacy Center model had only been around for about 12 years. There's now over 950 across the United States. We're one of 12 in the Commonwealth. But our county had the foresight to really say, hey, this is the direction we need to go in supporting children in our community.
All right. So having said that, we know how you were formed and why it's necessary. How is it funded?
Yeah, so we are a department of Barnstable County, and so a little bit more than half of our funding comes from Barnstable County directly.
Okay.
However, to really expand our programs, we have a lot of state and federal funding coming from grants such as the Victims of Crime Act, partnerships through the Massachusetts Children's Alliance. So really bringing in that additional funding to expand our programming.
Right. You talked about the counties that you serve, obviously not just Barnstable County, but over at Dukes and Nantucket County.
Yeah.
Who do you serve as the people, as citizens, residents? Are you serving all of the residents of this area?
Yeah, so when the Child Advocacy Center, when Children's Cove was formed, this was done with an agreement that we would serve the same jurisdictional area as the District Attorney's Office. Okay. And so that was where that had been done. And who we serve is really any child that has been identified or suspected to be a victim of crime. So reports that go to law enforcement that involve those specialized cases that I mentioned, or allegations of abuse or neglect that make its way to the Department of Children and Families and involves those areas as well. So anything that takes place within this jurisdictional area where the alleged crime took place would fall into that, because the investigative agencies we work with coordinate with us to ensure we're providing a safe, child-friendly, comfortable environment that offers a streamlined process for these investigations to maximize information for the investigation, but minimize the trauma to that child.
Right. And you talk about the services more to the agencies at this point, but what about the services to the child? Do you provide services for the children and the families themselves?
Absolutely. Prior to the Child Advocacy Center model in the 1980s, child victims of crime, if they made a disclosure of abuse, would have to talk to as many as 5 to 8 different individuals and talk about that trauma 8 to 11 times. And so, the very first piece that we offer is creating that streamlined, safe, comfortable place where children can have these conversations, minimize the trauma there. But for every single case that comes in, we organize what we call our multidisciplinary team. That's made up of external investigative agencies, law enforcement, DA's office, DCF, but then internal team members as well. We have on staff a pediatric sexual assault nurse examiner who's hired and funded through the Department of Public Health. We have 3 forensic interviewers on staff to rotate through that, one of whom is our child exploitation program coordinator. So any cases that have that high risk related to potential trafficking or sexual exploitation, there's an even higher level of coordinated response that goes into that. We have a family services coordinator who really looks to see what are the needs of that family. Every case that comes in is different. We serve children from 0 to 17. And the needs of families, whether it's one child or numerous children, whether they're siblings, whether they've been taken into DCF custody, the needs of that child and non-offending family fluctuate. And, how can we really support the recovery of that child? And so we'll work actively with them, walk them through any processes that they may have, coordinate to trauma-informed mental health providers in the community, non-clinical supports, that are out there. Really, anything that we can do to benefit and support that child and non-offending family in their recovery, that's our focus.
Right. What are the costs of these services?
So for the children and families that come in, there is no cost. Not for our services.
Right.
There may be services for external vendors, right? So obviously mental health and all of that. We try to take a lot of the weight off of families by supporting that coordination, working with them to get their permission and consents, getting health insurance out and all of that. But we'll also work directly with Massachusetts Victims Assistance with that family if they seek to pursue that,
right,
which will compensate them for anything that may be needed following that disclosure, or if there's anything that moves forward. So our services are nothing, and then we work to try to make sure that they've already had a trauma and a burden added to their lives.
right,
There shouldn't be a financial one as well.
right. Is there a referral process? Again, I know you're working with specific agencies, but something outside of that agencies, are there referrals and a process for that?
Every time that we receive a call for maybe a concerned community member, a family member, somebody who's learned something, we try to do our best to identify, what's going to be the correct process to get this to an official investigative agency. We don't operate independently with these types of investigations. We want to ensure that it's being done with our partners. We'll file a 51A if needed, if information has come up that's an allegation of abuse or neglect, or we'll try to provide warm handoffs to an appropriate law enforcement agent, a detective or somebody who can meet with them individually to get that first report, and then kind of take that step from there. But all of our referrals come from law enforcement, Department of Children and Families, and then we do receive occasionally calls from the local hospitals. If somebody presents with a sexual assault in the emergency room, pediatricians, they make calls, and then again we'll kind of triage that process to get it to the right agency.
Okay. This is so difficult for parents. What would you suggest parents do if they suspect abuse? Or again, it doesn't always have to be a parent, it can be a guardian or a teacher or something. What are we looking for? What do we do if we suspect something?
I think the first thing is don't keep that to yourself.
Okay.
I think a lot of times we may have concerns, and that may come from a place of like an instinct, a gut feeling, something doesn't feel right here. But then there's a fear related to saying that out loud, right? What if it's true? What if it's not true? What are people going to think about me? We are accessible. Our office hours are Monday through Friday, 8:30 to 4:30. We're available for phone calls. Call us, talk through it with us. If you're not quite sure what to do or where that is, one of our team members can connect with you, talk directly about that and offer guidance. We also have a lot of information on our website, specifically for parents and community members on what are those signs, what to look for, and how to have conversations. What are things that are okay to say or ask, or how to ask them, and things that we suggest you not go down because we don't want to create something that may not actually be there. So.
All right. How do we prepare our children to understand, what appropriate touching is and those types of things? I know your website is a wealth of information. Do you have some insight for parents and guardians here to, how to have these difficult conversations with children?
Yeah, I think the very first thing is to remember or to put ourselves in the position of being a child. First thing, we probably never had these conversations as children, right? And so we don't have a role model to go off of. We don't have that path that was walked before us to teach us how to do it. So I think the first thing is to acknowledge that and say, all right, I know this is hard to get started, but getting started is important. It really, we have a saying, it's have the conversation.
Right.
Have that conversation early and have it often. It doesn't mean you need to dive right into the sexual abuse and what is that. We would like to really focus on parents starting conversations about body safety, right? Parents talking with their children, naming the body parts correctly, right? A penis is a penis,
Right.
vagina is a vagina, a bum, breast, using those terms, using those words to destigmatize them.
Right.
It also, when we acknowledge that, these words, we take the stigma and fear away from them. It makes it easier for children to talk about this as a normal conversation, and that if anybody has touched those parts of their body, they're going to use the correct term, whether they say it to their parents or someone else who will recognize it. Establishing those privacy rules. I think it doesn't need to be one of those long drawn out conversations we think about. It can be, we're going into summer, or maybe you're on vacation and you're going to bring your kids to the pool. Hey, the parts of our body that are covered by a bathing suit, those are private parts, and nobody should be touching those parts or asking to look at those parts, and they shouldn't be asking you to touch those parts of their body or look at those parts of their body.
That's a great way to put it.
It's these small moments that we can bring up, and it may seem strange at first to just bring that up, but we normalize the conversation the more that we have it, and in appropriate contexts.
We've talked about how if parents suspect abuse, where can they learn more? I know your website has some areas on it. Do you want to kind of tell folks how to navigate through that area?
Yeah, of course.
And where they can find information if they suspect something?
Yeah, we have specific sections on our websites right for parents and caregivers. You'll be able to find it pretty easily as soon as you get on there. Talking about how to have these conversations, what are ways to start, some conversation starters. We also found that using books is really important too. We have a book list for parents on our website that some of them address sexual abuse and talk about that, but some of them don't. They just talk about how do you navigate difficult conversations about emotions or feelings or personal space. The more that we engage with children and talk and have natural conversation to destigmatize this, it makes it easier for us, and it teaches them that it's okay to have these conversations with parents, right, with their parents. Because if we don't start until they're well into their teenage years, when they're already distancing themselves from their parents, it's going to be really hard to start that up then. We also have been dealing with a lot of issues and a lot of questions related to online safety.
Yes.
And we've seen a big jump of those challenges and those cases coming in over the last few years, especially with the beginning of the pandemic. And it's continued ongoing, and so we have a whole section related to online safety and how do you have that conversation with your children as well.
Are you located on the county complex?
So, no, we are located in Barnstable. However, we don't publish our address. We keep it confidential. Given the nature of the work that we do, we want to make sure that children and family know that when they come to Children's Cove, one, they're in a safe place, and two, it's private and it's confidential, and you're not going to have a family member driving by and saying, I wonder what they're doing over at Children's Cove. We respect the fact that these are already challenging situations and need discretion.
Yeah, if you could give the top 3 things that you would want parents and caregivers to remember from today's conversation, what would they be?
If you have a question, you have a concern, call us. We are here. We are accessible. We want to talk with you. We want to answer your questions. So if you have a question, call us. If you're not sure you're ready to call us yet, there's a lot of information on our website, which is childrenscove.org. There's a link to our website directly off of the capecod.gov website, so you'll be able to find us. And I think the third thing would be we need to work together to reduce or eliminate the stigma around talking about sexual abuse, talking about body safety. 1 in 5 children will be sexually abused before they're 18 years old in the United States. And 90% of child victims will never disclose their abuse in their lifetime.
So have the conversation.
So have the conversation. We can create a community which is free of abuse if we start that conversation today.
Excellent. Thank you so much, Jacob.
Thank you for having me.